Hello, this is Dr. Farzad welcoming you to this introductory video on low-force chiropractic technique. Low-force chiropractic adjustment technique provides an excellent option, particularly to those patients who are afraid of those popping and cracking sounds involved in the traditional manual chiropractic adjustment. This type of adjustment is done by softly and gently stimulating the joints through a handheld instrument called the Arthrostim. The thrusts are often painless and are described by patients as feeling pleasant. This type of adjustment works by the high speed of the thrust of the Arthrostim instrument, eliminating the need for a high force thrust on the spine, which may sometimes feel painful to the patient. This makes it possible for any patient at any pain level to tolerate the adjustment. Another effective feature of this technique is the precise repetitive thrusts of up to 12 times per second that the Arthrostim instrument can provide at high speed. The nervous system is divided into two categories: the central nervous system and the peripheral nervous system. The central nervous system is comprised of the brain and the spinal cord. The brain is the power generator of the body, generating the electrical impulses that is sent down the spinal cord and out to tissues, organs, and systems in the body via the nerves of the peripheral nervous system. Nerves are the wiring of the body, carrying electrical impulses from the brain out to the tissues and vice versa, carrying information from the tissues back to the brain. Electricity is the first physical manifestation of the vital force, or that invisible intelligent high-frequency energy, or the healing energy, also referred to as bioenergy, that runs through our body. Misaligned vertebra in the spine can put pressure on the nerves exiting the spine and can diminish the power of the flow of electricity needed for the proper two-way communication of the tissues of the body with the brain. Diminished electrical flow in the nerves that innervate muscles results in muscle spasm, which in turn puts more pressure on the nerve that innervates the muscle in question. Pain can either be caused by the pressure or the interference to the flow of electricity that is put on a nerve by a misaligned bone or vertebra in the spine, or by tight spasmed muscles. Therefore, relieving pain is a combination of correcting vertebral subluxations or misalignments through spinal adjustments and relaxing tight muscles. Two tasks that are painlessly and effectively achieved by the Arthrostim instrument. In order to correct misalignments in the spine, in addition to moving bones to relieve any stress on the nerves, the Arthrostim instrument is also capable of stimulating the pressure receptors, also referred to as mechanoreceptors, found within the joints of the spine. Just as pain receptors sense pain, pressure receptors or mechanoreceptors sense pressure as the joints move in our spine, sending healthy signals to the brain, letting the brain know of the proper functioning of the spinal joints. In case of injury or trauma to the spine, joints become fixated and their movement becomes either limited or completely stopped, therefore also limiting or stopping healthy communication between the spinal segments and the brain. The pressure receptors, as they are stimulated, communicate with the brain, letting the brain know of the health status of that area. In case of trauma or injury, as the pressure receptors are stimulated by the Arthrostim instrument, the brain sends electric impulse or life force to the injured area in order to correct any misalignments or muscle spasm around the joints, helping to heal the area and therefore decreasing or eliminating pain. Among other actions of the Arthrostim instrument, besides correcting spinal misalignment, is also relaxing muscles around the spinal joints by instantly removing any muscle spasm that may be putting pressure on the nerves, therefore decreasing or removing pain. Following the adjustment, patients often report feeling an immediate sense of lightness and relief, and describe their experience as being painless and pleasant. Chiropractic adjustment is not only about pain and pain relief. In fact, about 80% of our nerves in the body don't have pain receptors, and therefore in case of trauma or pressure, they are not capable of sensing pain. Only about 20% of our nerves have pain receptors and can sense pain. The 80% majority are nerves that innervate our organs, such as our liver, pancreas, heart, lungs, and more. Pain is merely a signal telling us that something is wrong and needs to be corrected. In case of interference in the nerves that innervate our organs, there is no signal to immediately let us know of the presence of a problem, until such time that the end organ becomes dysfunctional and we're faced with symptoms. Regular chiropractic adjustments remove nerve interference, therefore unblocking the flow of electrical impulse through the nerves, allowing the whole body to receive signals. This electrical signal is the first physical manifestation of the life force, or the vital force, or the intelligent invisible healing energy, also known as bioenergy, that is running through our body. I hope that you've enjoyed this presentation on low-force chiropractic technique. For more information and questions, please use the contact information by visiting illnesstowellness.com/contact or refer to the information below the video screen. Once again, from Illness to Wellness, this is Dr. Farzad wishing you all health, joy, and lasting peace of mind. Thanks for watching.